Thank you for coming back to the Academy Table. I'm Renee DeSilva, CEO of the Academy and your host. In each episode of the table, I'll bring you real conversations with healthcare's best leaders and thinkers. We intend to broaden who is at the table while covering the issues that are critical to driving our industry forward. I'm delighted to share this conversation today with my friend and colleague, Erickajoy Daniels, who is the Senior Vice President and Chief Diversity, Equity, and Inclusion Officer at Advocate Aurora Health. As I learned recently, Erickajoy's career path started in military research before spending more than a decade at the Federal Bureau of Prisons in their talent and leadership development function. She joined Advocate Aurora in 2015 and continues to have a strong impact on the system's DE&I strategy. I always look forward to spending time with Erickajoy, who I think brings a unique and clear perspective to health equity, which is the center of our chat today. There are a few things I'd call your attention to in my conversation with Erickajoy. First, as she puts it, the power of curiosity. We discuss authenticity and curiosity as enablers that help people jump into and manage hard conversations around race, equity, and inclusion. Next, listen for her thoughts on how to activate different health system stakeholders, whether that's providers, department heads, the board, in elevating health equity as a true strategic imperative. And finally, I love her thoughts on the importance of supplier diversity and workforce investment. And as she puts it, investing has to be more than just writing a check. It's about accountability and building trust with the community, because that's where patients and team members come from. Taken together, what Erickajoy shares here represents what it looks like to truly and holistically invest in health equity. So with that, let's head to the table. Erickajoy, thank you so much for joining me at the table. Happy to have you here today.
Thanks so much, Renee. Glad to be with you all.
I get to see you a couple times a year. I have not seen you in quite some time, but I'm excited to have this conversation with you around health equity. I think that you have one of the best and most clear perspectives in the industry around the importance of that. But before we jump into that topic, I know that you are on a mission to transform healthcare. Healthcare is not necessarily where you started your career. So tell me a little bit about how you found your way into the industry.
Yeah, Renee, it's interesting. I have a little bit of an eclectic background in my career. I started actually in military research and early on with the U.S. Army, not enlisted, but I did soldier stress endurance research, interestingly enough. Went from there to gerontology research, and then I went to prison. I worked there, did not live there. I worked for the Federal Bureau of Prisons for almost 13 years and had progressive roles in talent development, leadership development, affirmative action, community corrections, and was on a career path to be a warden. I had a mentor who was, leading me and guiding me and helping to shape me, who's still with me today. And then I found myself exiting prison and went into manufacturing. So I got recruited by a company in Milwaukee that was a global company, still is, and they do manufacturing signs and labels, and had roles there in talent management, organizational development. My background is really industrial psychology and OD. And so those roles and those environments became really a platform for me to learn a lot. Skill development, strategic, understanding people, influencing people. And then I found myself with a call from a healthcare system that asked me about looking at a role in diversity, equity, and inclusion. And at the time, it wasn't really an area I thought I wanted to go into. I had some biases, I guess I'll admit, that some certain, oftentimes those roles were kind of pigeonholed, or organizations say, hey, we got to do diversity, so let's find a woman or one of color, candidly, put them on the website and But when I talk with the leadership, I saw it as something new. I love building things that don't exist. I love connecting dots that people don't see. And the opportunity to build something from the ground up, and particularly looking at where we are now, I feel like I'm up to change. As you can see, I've changed industries, I've changed roles, but I really feel like I found a niche to bring a balance of my career experience into something now.
Yes. And I can see the patterns in what you just walked through. So when you talk about stress research, when you talk about even the prison work that you did around training and equipping those leaders to do some pretty, some important work, I can see how that would connect back to healthcare. And I imagine you can draw on that body of work quite liberally. I didn't know that I knew that about you, but that's an interesting, I guess, maybe evolution of career steps that you've taken. So if we stay then, I love your sentiment around the maybe a little bit of skepticism with which you approach the diversity, equity, and inclusion work. And I would even say across the last several years, maybe most acutely this year, maybe the national conversation around it has certainly moved. So maybe let's just start there. How have you seen the conversation shifted in both leadership circles, in boardrooms, just on the front line as it relates to the importance of equity and inclusion, particularly within the healthcare setting?
Yeah, it's interesting because, we've heard the term before, perfect storm, right? But it really was a storm of a number of challenges last year. COVID started to hit communities in a continual way that shone a light on the disparities and the inequities and how marginalized communities get impacted differently. And for those who know, whether through lived experience or awareness of understanding and equity and that kind of body of work, it wasn't new news, but it was, to me, surprising that it became newer news to others. And so I do think it was, this clarion call to say there's an attention that needs to occur to understand the dynamics and the implication across groups that may be different than we expect or assume. And then you layer on top of that economic forces, you lay upon that the forces of racial tension and the situations that came from, the George Floyd murder and those instances, while at the same time in COVID, people are hibernating and staying at home. We had nothing to do but look at television and watch newsreels and watch updates on our phones. And I just think that we were in this moment of being contained for a time of attention. And people sprung out. There's so much research. I saw LinkedIn numbers about the increase in CDO roles within last year, and people kind of like scraping like, maybe we should do something about diversity. And in healthcare particularly, we know that, and no matter where anyone else in the country, we're here to help people live well. That is our tagline, but it's a shared line just of the industry. And are we making sure that all are living well? And it caused us to question that differently.
Absolutely. So let's just stay on the clarion call as you mentioned it, and just to maybe put some data underneath that. So when we looked at communities of color, we saw that they had a roughly 3 times higher hospitalization rate. Death rates were 2 times higher. I've heard you talk about maybe getting to the root cause of that. And sometimes that root cause is not as obvious as just maybe greater rate of comorbidities or other susceptibility factors. Talk about just maybe the dot that you connected around, maybe what drove some of that inequity and outcomes for communities of color from your lens.
Yeah, it's interesting because when we were trying to understand more, you're right, the data always leads us, right? And there was the quantitative data about the cases. And then we drilled in and say, well, where are the cases happening? They're happening in these geographies and these zip codes. Okay, well, what else happens to reside or not reside in those zip codes? What dynamics are impacting people's health? And you go back to the age-old understanding of social determinants of health. These same zip codes have issues around safety, have issues around being food deserts where food insecurity is a continual burden. These same places don't have the same accesses to physical activity and workout. So the things that you would prescribe, quote unquote, to an individual to improve their health, there may not be the ready opportunity to really fully leverage all those assets and tools. And when you get at the heart of that, along with listening, we did a lot of listening in our community and not making assumptions, taking the time to be on the ground at boot level and say, what are the real needs? And even if we took COVID, for example, just as in, it was an absolute petri dish and lab for us to learn. We're telling people quarantine, we're telling people to mask up. Okay, but can everyone mask the same way? Does everyone have access to those? Because when you think about multi-generational households, it's not as easy to just find your own private place there. School started to shut down and kids were at home. So it really caused us to really uncover and unbundle all of the dynamics, recognizing we couldn't fix them all. But what could we take our responsibility to either address ourselves or find partners to collaborate with to make improvement?
Yeah. And staying with that a bit, I loved what you just said. The data leads us. And I think we know in healthcare that we're all on various stages of maturity curve in terms of the data that we're even capturing. We've been doing some work at the Academy around health equity in terms of just really trying to understand what that maturity curve looks like. And one of the things that we note is some organizations aren't really even at the point now where they're capturing the right amount of demographic detail upon registration or other access moments. And so just to start a little bit around just unpacking how do you think about setting up the data infrastructure at the earliest parts of interaction with patients that then allow you to mine for where the opportunities are? Where does an organization begin?
Absolutely. I mean, the core fundamentals of just real data, race, ethnicity, and language, getting that insight on your patients gives you intel into how to best address them and their needs. And it also enables an organization to understand where their greatest areas of opportunity are. Because the more that you go at things at the macro level, those who are being adversely impacted at a micro level will never reach the surface to get the attention that's needed. So understanding someone's race and ethnicity, understanding their language preferences. People don't realize how much language preference and access and supports in that manner contribute to health equity. To be able to understand and comprehend and be able to connect with a provider for your greatest care so that you can get those better outcomes. Once you have that information collected, and even I want to stay there too for a minute, Renee, when I think about not just the collection, but the appropriate collection and understanding how you even ask for the information.
Yeah, say more about that. Say more about that, because I think that can be a barrier in terms of how do you actually make the ask in a way that lands well with the person on the other side of that conversation.
The ask should come with the why. Why do I want to know your race and ethnicity? Because it helps me help you better. It helps me understand everything from cultural nuances that I should be attentive to. If someone's a Jehovah's Witness, and understanding restrictions around blood collection, or if it's understanding, like I said, language need, if getting your information where you have a written language or a spoken language, right? Understanding when I provide a diet for you, transformed diet, it doesn't just mean I should put it in another language, but is it tied to the foods that you are already connected to? We just want to cook them differently. And those things matter. And if someone understands that and that trust is there, they'll disclose that and more. They'll provide because they're understanding you're coming from an authentic place of learning them, even to the fact of thinking about some pharmaceuticals don't have the same efficacy across certain groups. So we have to have that intel to be better informed in our decision making. And then you get to very dicey information like sexual orientation and gender identity. You have to be very careful how you ask, why you ask, and the collection, the protection of that information. So that kind of education to those who touch the patients to get the questions answered, and then the adequate tracking to ensure that we are collecting it and keeping our eye on it and using the information for our decision making.
That's right. And we generally, as leaders, perform to what we measure. There's now a national conversation at CMS around this notion of a hospital equity score, which would take a stab at synthesizing some of the social risk factors, the disparity measures, holding providers maybe accountable for how they're nuanced in that. So that it's good to see some of these national conversations happening. I guess, what are your thoughts on models like that? And it maybe just comes down to, when you think about all the data that we're collecting, how do you even start in terms of figuring out the metrics that are meaningful to drive the right outcomes that we're hoping to achieve as an industry?
Yeah, it's funny. I said earlier about the kind of the breadcrumbs in my career path, because I remember when I came into healthcare, coming from a manufacturing standpoint, we measured a lot for productivity, for safety, for quality, for delivery to door. And I thought, what does that look like? Like, what's the process and the evaluation in healthcare? And I quickly learned what that looked like. And we measure a lot in our industry because it really informs us. When even asked around what measures do you collect, my first questions here were, what do we already measure that's important? We just need to stratify it by the dimensions of diversity that are meaningful. But then you take it to that next kind of level of maturity and you're saying, where do we need to dig deeper? And I do believe that composite scores or a health equity score for an organization gives you a few benefits. One, it becomes a singular place to understand and I say this carefully, the complexity, but the richness, maybe I'll say that instead, the richness of how many attributes it takes for accountability to really drive and advance health equity. The other benefit, I think, is that it also incorporates and engages the multiple stakeholders, because each of those measures come from different parts of the business, which come from different process and data owners. So it becomes a collective effort, not just a single department that's trying to raise health equity to its premier place. And in doing that, designing what that scoring model looks like, agreeing upon what we believe we should measure, even if it shows us it's something we're not measuring now, but we need to do the homework. Sometimes that will surface as well. But I do think a singular place of, it's like in your car, you can see your oil, you can see your battery, you can see your mileage, you can see your gas, but it's a single view. And having that dashboard enables you to see and have the quick alert of, oh, your engine's not working well. Your health equity engine's not working. You don't have to pop the hood and think everything's awry, but I can zero in and understand where my misses are.
I think that's right. I think it's also an opportunity for providers to drive the conversation versus responding to it, right? So sometimes when CMS or CMI get involved in things, the aim and intent is there. I guess maybe the path can be debatable at times. And so I'm hopeful that many of our members will have an opinion on that and really try to drive the conversation so that we adopt things that are actually useful and impactful to the end state of the patient experience.
Yeah. And that we own it, not for it to be imposed upon us.
Exactly. So staying a little bit on that, one of the things that I've noted in the last, and I probably would say last several months, is that the board level conversation on equity is becoming much more active. And I would say that Advocate Aurora, and there's maybe one or two health systems that I'm aware of that are also forward leaning on this, recently stood up an equity committee of the board. So the same way there's a quality committee, an executive compensation committee, an audit and finance committee, there's now an equity committee. And that's interesting to me in terms of a really strong signal in terms of board level requirement around really leaning into this and getting this right. Talk to us about just that journey that you all made. What was the impetus for that? And what's the charter of the equity committee of the board?
Yeah, so I think it follows suit with these building blocks that we've had of lifting diversity, equity, inclusion to a strategic imperative in the organization. I first got to Aurora at the time because I came in at the time before the merger. My personal determination, I was like, I'm going to make DE&I a strategic imperative for the company. I want to show them that it's a strategic enabler and it can drive this business like nothing else. And in doing so, operationalizing the work was very key, and getting the conversation to be led by people outside of who had the signature block of diversity. That was really important. I think in doing that, when leaders are sharing and understanding that it is an enabler, it is a prioritization, we then were able to arrive at a place where it's lifted to that esteem. And associate, just like you mentioned, the same level of those other committees, just like at governance level, you keep an eye on those most important levers of the enterprise. It was recognized that DE&I was at the same place. So internally, we were raising it as part of our annual incentive plan. It's part of our monthly scorecards that all leaders not only see, but are held accountable to. So we were growing that momentum. And then at the same time, we had increased board interest, engagement, and really personal learning, where they're growing and seeing what questions do they ask, how do they engage with the organization to understand what role they should play. And so a great combination of the two, which led to our committee, which we launched this spring recently. And the role of that group is to understand the strategic priorities around diversity, equity, and inclusion, and understanding the connecting points, how they can help us to bring the right challenging questions, the right support. And then when they're in other seats of other committees or on the full board, they can raise and bring the connections into broader conversations. When you talk about getting a seat at the table, we don't have to physically be present from management because that voice and that positioning is coming in because the board's voice is bringing it. And that's a great ability. Yes, yeah. Absolutely.
And is their charter, it's DE&I holistically, so the workforce side of it, the community side, the patient outcomes piece as well?
Yep, absolutely, because we also don't want to miss the connections that really lead up to that big, due north of health equity. But, representation affects health equity. Our community investments affects health equity. So we wanted to go at it with a comprehensive view.
So if you stay on the board topic for a moment, you and I have both worked closely with an organization, Black Directors Health Equity Advancement, Inc., which is a coalition of current healthcare Black directors that wanted to mobilize to also try to be a little bit of the clarion call around just the importance of advocating for this in boardrooms across the country. Talk a little bit about how we need to equip current directors, whether they're of color or not, to maybe ask the right questions, drive the right conversation. Is there any advice that you'd offer in terms of a playbook or some tips or tactics around if you find yourself in positions of influence, what's the right way to nudge and move the conversation along just based upon some of the work that we've both done with BDHEA?
Yeah, I mean, the interesting thing is that at the point of who's responsible for providing care across the country, we kind of take competition out the conversation, right? That we're all in it for the improvement of the health of our nation. And hospitals, large and small, around the country have directors that can be in a position to help influence so that happens. I think having a collaboration like this helps to provide a critical mass of drivers. But those drivers, how do we empower them through education and research, understanding of what's latest, while at the same time a healthy balance of what's practical and how it can be operationalized in the organization. The questions that can be posed and asked can happen at any committee opportunity and voice, or like I said, any broad board discussion, but bringing to bear resources, white papers, research. Just this past year, the focus was around, we created a quick reference guide around COVID. Here, based on the data that we understood, there were webinars. Everyone was doing webinars, right? Everyone was doing webinars. And how do you put your mind around all the information out there? We were trying to channel it in, bring the best to these directors. Here's what you should know, and then here's what you should ask. That resulted in this one pager like placemat. Here are key questions to ask as it ties to fiduciary responsibilities or for governance, or if you're looking for new individuals to come onto your board. And that quick reference guide became really like a quick cheat sheet. So directors could know, particularly when some directors are coming from spaces that their career experiences are not in healthcare. How can we get them? Because health equity there's an urgency about this work. And we want to make sure, can we be any kind of asset to shorten up and tighten up the learning curve so they can be deployed immediately and be in the conversation?
That's right. Yeah, I think there's power in catalyzing the right conversation. There's a way to move through that conversation where just you as maybe the person of color on that board does not have to be the only one that really holds the mantle. And I think a lot of those conversations were oriented around how to do that at scale. And I think that is a really powerful way to continue to drive momentum here. So excited to see how that continues to unfold. So we've talked a bit about within the four walls of the organization and the role of providers in trying to drive more, quicker movement and momentum on closing equity outcomes. And that starts at the board level and it goes all the way through the organization. I think the other thing that has been prioritized at Advocate Aurora certainly is around the community. So both from the supplier diversity and maybe workforce investments angle. Can you talk a little bit about that journey and maybe what you've seen work within that space?
Yeah, the community becomes such a key anchor because it's where you get your patients from. It's where you get your team members from. It's where your brand is either elevated or not fully supported. It's where your growth happens. And relationships matter. I always think that in our industry, we know that systems are getting larger and larger. No matter what the size, healthcare is still local. People need to know that there's a connection because that builds trust, and trust builds relationships, and relationships are really at the heart of any truly effective, health connection for outcomes. And so for us, we make sure that our community partnerships go beyond just relations and events, right? But are we hearing from them? Are we listening? Are we tuning in? Are we making better informed decisions because we build with our community and not just assuming for them? And so our partnerships make a difference. Our organizations that we're strategically tied to, that are connected to our priorities, help us, whether it's from recruiting events or whether it's sourcing talent or building new vendor relationships and opportunities. And like you mentioned, supplier diversity, we have, especially with our size, we have a responsibility with our spending power that those dollars should also be specifically placed in areas that may otherwise get looked over. And that's how you grow the economic health of a community.
Can we stay on that for a second, Erickajoy? Because I do think I read through the Equity and Inclusion report from Advocate Aurora this year, and I was struck by just the level of specificity in terms of goal setting around supplier diversity. So this wealth creation and economic support, I think, really came through. So it looks like across the last 3 years, you all have really doubled down on that investment, having a specific target of percentage of spend on women, people of color, veteran, groups of different ability. I think it's interesting when you have the goal, right? Like you sort of set a particular segment of the spending on that. And then there's the habits that we all get into in terms of, I need to source something very quickly. How have you all built the systems? And I know that you're not in the supply chain per se, but just like at a really high level, how do you get to the intention while not maybe slowing the day-to-day work of all the teams? So how have you all balanced those two objectives?
Absolutely. You really have to take the time and the candid approach of saying, are we willing to evaluate and understand our current behaviors and preferences and understand, are they in contradiction to our desired outcomes of investing in the community? And I say that because we have shared conversations. So I don't just meet the supplier diversity under our area of responsibility. We meet collectively with supply chain and with finance and with construction. Because the one thing I've shared with my organization here is that anyone who has spending authority has got supplier diversity responsibility.
Yep.
If anyone can write a check and spend money, you need to be held accountable there. So the system goal helps us get there, but you're right, but the behaviors is different. So reevaluating, understanding, are any of our processes barriers, like our net pay terms or our requirements on insurance liabilities? And we've been looking at those things to make sure that we don't have barriers that are contradictory to the outcomes that we're going after. And it's been really encouraging to see that shared ownership. We've got construction leaders who are saying, we know we have in build, we know we have in bid, but who are we missing? Or who do we bring along? Who do we mentor? How do we find programs that will provide that? And it's not just finding the businesses and giving them business, but it's also giving them opportunity, giving them feedback. Investing can go far beyond just dollars. We've sent different smaller companies to business development programs like at Dartmouth, because we believe investing has more than just, a check behind it.
That's right. I think just to underscore your sentiment there, that we can all have good intentions, but sometimes just the way that we run processes can get the better of those intentions. So you talked about maybe it's the terms or things that are required that would just make it harder for a small business to compete. I think you could draw that same parallel on just the workforce side of it. So when you think about filling, candidates,
just like talent.
Yeah, exactly. Exactly.
Yep.
So the dots connect.
Mm-hmm. Even looking at how you look and when you look, forward thinking, you don't have to just look for a new hire when you have a position that's open. You can keep your eye out there on what talent maybe you want to grab one day. The same thing with vendors. You may not have the bid, may not have come up for a term yet, but do you have your eye and do you have a network of accessible, businesses that you may seek after?
That's right. I talk a lot about this too. It's you have to invest in the relationship building with those groups that maybe you are not as well connected with. Our own social networks, and we're all very guilty of this, like no matter who you are, you tend to get into a rhythm, right? So when you're recruiting, you go back to the very familiar sources. And so just building out those relationships in advance of need is an important way that we do better on all of these metrics. Because, humans left to our own devices will take the easiest path forward oftentimes. So what you're saying here in terms of investing in advance of need makes a lot of sense to me personally. So let's talk about your own leadership style and your life experience and how that impacts how you show up as a leader. I'm just going to go back to where we started the conversation around maybe your early reluctance to take on the equity and inclusion role, being aware of the fact that you are a woman of color and, not necessarily wanting to pigeonhole yourself into a view. I guess at the same time, that's a force multiplier too, because you have a shared experience, a lived experience that's important to all the work that you're doing. So where has your own journey been on that? Like how you reconciled that? Just talk to us a little bit around how you show up and how that's shaped by your sort of personal experience and background.
Yeah, having a mentor, having a at-home consultant, otherwise known as my husband. People who check you. And interestingly enough too, Renee, my son is 12. He's a very astute old soul, but I think, when you allow people to have that visibility in your lives, they can help you calibrate a few things. I never forget one time I had gone to a local leadership meeting externally in the community, and I was fired up. I wasn't there being as a representative of diversity and inclusion. I was there for another reason. And I was thinking, I should say this. I'm like, no, but they won't, because they just expect me because I'm the only Black person in here. And I came home to tell my husband, he said, well, if you didn't say it, who would? I was like, thanks, dude. Then he said, and if you already think they're expecting you to say it, then why wouldn't you just share? So that has stuck with me of how do I leverage my voice and use it responsibly? I do think there's an art in how we share and how we challenge and how we nudge and how we provoke, but I do think there's a time and need for it. And so I've had to really calibrate that often with myself, whether it's something I write to myself first to make sure the words came out effectively or understanding the place and also the place and the space for it. There have often been times where I've reserved my concern, or I often say I'm curious, my curiosities for a more private environment, because I never want to blast someone, but I do want to challenge them so they can be better.
You can't see me because we're not on video, but I'm shaking my head and I'm looking like a crazy lady because yes, everything you said, yes. I think there's an awareness when you're the only in a room, whatever that only would be come after that word, that I would say for myself, it's been a journey because you are aware that you're often the only. You sometimes are still really getting comfortable with your place at the table. And there can be a self-talk that might cause you to hold back on things or to maybe just want to play a little bit smaller than you should. But I have said to myself, even for me more recently, is if not me, then who? There's also the privilege with the platform. And I think it would be irresponsible really to not use it. Now, I'm totally with you. I say the importance of calling people in versus calling people out. And the way that you have that conversation does make a world of difference. So,
yeah. And the relationships needed to do that. Because I do think that relationship and rapport, when as much as possible, sometimes you have a short window of time, you can't build a long-term relationship, but some kind of rapport or connection that can precede a challenge or a feedback can go a long way.
That's right. And that requires all of us to just spend the time on the things that are important but may not be urgent, to sort of seed that relationship capital in advance of need and just be really, really thoughtful about how we do it. And then, there's also the role of allies in that conversation and then how you tap into other people to help amplify that. Talk a little bit around how you've thought about that in your own career.
Yeah. So, the power of allyship is, I have found for myself, I learned when I stumbled incorrectly that some of the best allies are the most unusual suspects. That I can think of a few people early on in my career that probably would have been strong allies, but I had my own biases kept me from extending the relationships. And holding on to that lesson and interestingly enough, what I learned in prison. I learned a lot sitting across from inmates. And there are just assumptions we make about people that can become such an impediment for us getting something valuable that's mutually beneficial. And if we would just be willing to suspend our judgments and our understandings and seek to do differently. It's like when I meet people, people are like, oh, I met you and I looked you up on LinkedIn. I'm so bad because I really don't like looking people up until I meet them, because I want to come with a fresh understanding of who they are, and I think for allies, finding people in places. So I often look for the places where I feel like I either don't have reach or influence, because I first want to learn from them what I don't know about that space or that topic or that industry or whatever it is. And then, because I'm going to learn from them. And then, but I also am hoping that they can learn from me. So looking for allies that are mutually beneficial, not just an ally that can carry my message. That's been really important for me. And I think, and I think that ends up, setting up a more sustainable impact and people who want to build you up, because there's so much I want to learn. And I do also think from a sense of diversity, equity, inclusion, I always want to talk about it in context and application. And I can't do that if I don't understand the nature of what I'm getting into.
Yeah, you're curious. I love the word that you used earlier, just you're curious. I'm curious to learn more about that. That's a powerful framework to bring to what can sometimes be charged conversations. I've heard you all talk about it within your system as just having real talk, real conversations. And there's so much power in doing that.
And that curiosity too. I think it's also authentic curiosity is also what gives people grace to jump into the topic of diversity and inclusion. When leaders that are saying, I'm not too sure, I might mess up. I'm like, but if someone knows you're authentically curious, they'll give you a pass. So
that's exactly right. That's exactly right. I think there's power in terms of how that brings people into a conversation that they may otherwise not have been open to having. And I do think, for better or worse, this past year has made our collectively, people are willing to engage in things that would be hard. Like, we can do hard things. We can have hard conversations. And I think people seem to be more willing to do that really across the broader, really the world, but particularly within the healthcare circles that I tend to run in, for sure. So my final question, we, in launching season 2 of this podcast, we renamed it the Academy Table. And part of my vision for that was I want to create space for more voices to be at the table. And there's just so much joy that comes from being around a table, sharing a meal, sharing a glass of wine, a coffee, whatever your drink of choice is. And so my question for you, and you can, this can be some fictional people who are still with us or maybe have passed on, but if you could curate, if you were head of a table and could invite any 2 people for a conversation at your specially curated table, who would you pick and why?
Oh, wow, that's a good one. I almost want to bookend it with someone who's no longer here, who has a historical view, and someone who's here now that has a forward-thinking view, and find out, what did we miss and what's taking so long? So I'm trying to think of the who's, but I just think about, like, if I'm in the middle of the past and the future, what can I do to accelerate something different? So if I were to
perfect answer. That's a perfect answer. You don't even need to name names, but just that image.
Good.
That's a perfect answer.
That's what I want my table to be. Yeah.
That's great. That's great. Well, it's always a pleasure chatting with you. I appreciate your time today, and again, hope to be with you in person soon. But thank you so much. You're such a cogent, clear voice on an issue that can sometimes be murky. So appreciate always when you come in and give us your insight. So thank you so much for joining us today. I really do appreciate it.
Thank you for the invitation, Renee. I really enjoyed it.
Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.